Okay, let's try this again. I'm sorry for those of you that tried to tune in. I am hoping that you all can see me live right now on Facebook. Hi, everybody. I apologize for that glitch that we just had. I am Dr. Nicole Rochester. I am a board certified pediatrician, a college mom, the author of Healthcare Navigation 101, a guide for college bound students and parents, and I'm the CEO of Your GPS Doc. And tonight is our live Q&A session for college parents. I am here to answer your questions, all things COVID, coronavirus, going back to school, health related concerns, things of that nature. I know that many of you had an opportunity to tune into my webinar that we had last Monday, which was phenomenal. 10 things every parent needs to know before sending their kids back to college. Some of you may have started following me then. Some of you may have been following me prior to that, or maybe you've stumbled upon my page or saw another Facebook page, another Facebook post. But essentially, I am the mom of a college junior. I am a pediatrician with over 20 years of experience. And my mission with my company, Your GPS Doc, is to help individuals and their family caregivers navigate the healthcare system. So, as I am preparing to send my college junior back to school, I have been doing Facebook posts and Instagram and webinars and just really trying to be a source of information and support for other college parents. So I wanted to do this live Q&A session tonight, really just to serve you all and to answer any questions that you may have. So I am really open, just type them in to the comment section, and I'm going to try to follow along on my phone as well to make sure. I know there's a little bit of a delay, but essentially, if you have any questions or concerns about sending your kids back to college during a pandemic, about anything related to navigating the healthcare system for your kids when they go away from you and off on these college campuses, and even for the kids that are going to be remotely taking classes from home with you, there are still a lot of concerns that we all have as parents and things that we need to address. So, just let me know if you all have any questions. If you have friends that are sending kids either off to college for the first time as freshmen or sending kids back to school, I encourage you to tag them, text them, let them know that they can come on over here to the Your GPS Doc Facebook page and join this live Q&A session. I'm going to be here with you all for about 30 minutes. So just let me know if you have any questions. Let me make sure that I can see them. And again, just let me know that you're here. Type in hello. Let me know that you are watching. For those of you that may catch this later on the replay, just let me know again that you are here. I love engaging with the audience. I don't see any questions right now. I know my Wi-Fi was acting up earlier, so I hope that you all can see and hear me okay. So if that is the case, let me know if you have any questions. I'll let you know that, in the webinar that I did last week, we just talked a lot about all the things that you need to be concerned about as you prepare to send your child off to college. And the reality is that a lot of these things are pertinent whether or not we were in the middle of a pandemic or not. I mean, the reality is that our kids are not prepared to manage their own health. They're not prepared to navigate the healthcare system on their own. Hey, Carla, thanks for joining. So they don't get this information. This is not taught in high school, although it should be. This is not something, even as a pediatrician, I can share with you that we don't have special programs where we, intentionally transition our pediatric patients when they are preparing to go off to college to make sure that they're ready in terms of being able to speak up for themselves in healthcare settings, being knowledgeable about their medical conditions, their family history, and just things like knowing how to pick up prescriptions and how to navigate health insurance and all those things. There's so many things that our kids are not prepared for, and this is not part of a formal education. So, my first daughter is 25, and I just totally failed her, you guys. Like, when she went off to school, despite me being a pediatrician, I didn't even think about the healthcare part of it. I was so focused on finding those extra large twin sheets, extra long, and looking for all the little decor and the things that she wanted for her dorm, and making sure that we were clear about the payments, and making sure she had the books that she needed and all this stuff, and trying to reach out to her roommates' parents. It didn't even dawn on me that she needed to have a clear understanding of the healthcare system, and that she was going to be away from home, having to make doctor's appointments on her own, having to speak up for herself, having to be able to effectively communicate her medical history, all those things that we as grown adults struggle with, right? And it didn't dawn on me that she was ill equipped to do that. So I got a lot of phone calls and a lot of text messages. Mommy, should I do this? Mommy, can I do that? How much of this medication should I take? Can I take both this and that? Should I go to the student health center? Should I go to urgent care? Do you have my insurance card? Like all kinds of things. So the second time around with my daughter, who's now a junior, I did better. I was determined to do a better job preparing her when it was her time to go off to school. And I realized that she's not the only one that needs this information. So again, just this is really meant to be a Q&A. I don't have a formal presentation prepared. Hopefully you all were able to catch the webinar that I did last week, which was extremely informative. I'm definitely not going to repeat all of that content because I really just wanted to answer your questions. For those of you that got to see the webinar, maybe you have some additional questions now that you've had a chance to let everything marinate. To those of you who may have missed the webinar, you likely have lots of questions and concerns about sending your kids back to college and things that you may need to know and understand. So I am watching the comments and I am ready to answer any questions that you all have, just to kind of give you an idea of some things that you may want to start thinking about. You want to think about your health insurance and whether or not you are sure that that covers your child in whichever state they are going to be for college. You want to be intimately familiar with the signs and symptoms of coronavirus. You want to be intimately familiar with your kids' school reopening plan. Are they going to be doing testing? Are they requiring masks? Like what have the colleges and universities put in place? I can share with you that I saw this article. Some of you may have seen this article that was posted, I think, this morning for one of the universities, I think in Louisiana, and their solution to protecting their college students in the dorms during a coronavirus pandemic was to basically create this kind of contraption out of PVC pipes and put a cloth barrier. So this thing stands, no more than about this high, no more than maybe about this wide, and they just attach cloth, and that's what's sitting between the two roommates in the dorm room. And that is their idea of protecting students against coronavirus. Needless to say, that is woefully inadequate. I know that many of the college campuses, they are restricting the dorm occupancy and they're making it single occupancy only. I think that makes a lot of sense. That way they're minimizing the contact. They're making it easy for the kids to maintain, that 6 foot social or physical distancing. Some colleges aren't allowing any kids to come back on campus at all. They're doing it all online. There's so many different plans, but certainly what I have seen is that not every college and university is following the guidelines that have been set forth by the CDC. Many of them have other advisors, and many of them are dealing with, shoestring budgets, and they're just kind of throwing things together at the last minute. And, we can't take these kind of chances when it comes to our kids' health and safety. So that's just one of the many things that you need to be considering during this time. Many of you may have already sent kids back to college and you may be worried. In many cases, we're already seeing that as the schools start to reopen, even the primary schools and the secondary schools, we're starting to see cases of coronavirus rise. Undoubtedly, that is going to happen on these college campuses across the country. So, it's a matter of really just being as safe as we possibly can, doing as much as we can, and making sure that our kids are doing as much as they can to remain safe, but also having a plan for what to do if and when something happens. I think that we all need to prepare for the worst. We all need to assume that our kids or one of their roommates or one of their close friends is going to contract coronavirus. And so we need to proactively think about how we're going to manage those situations. So again, just let me know if you have any questions at all about, coronavirus, specifically as it relates to young adults, college students, going back to school, navigating healthcare. Let me know. So Marlena, let's see. Marlena says, my sister has sarcoidosis. Her daughter will be going back to college in September. I don't think it's a good idea to come back to see mom when she returns. Any thoughts? Marlena, that is an excellent question. I have been navigating questions from parents of college students about that very thing. What happens after we let them go? So, this again, let me just preface what I'm going to say by sharing with you all that while I am a medical doctor, this is not medical advice. I cannot dispense medical advice over social media, okay? But this is meant to be for informational purposes. And certainly I hope that it will provide you with the information that you all need so that you can make smart decisions for you and for your families. So to answer Marlena's question about her sister having an underlying chronic disease, which certainly puts her at risk for coronavirus, and then whether or not her child who's going off to college should come back, I think that every family is going to have to make their own decision. But certainly, Marlena, as you already know, sarcoidosis, is a high risk condition. It's something that impacts the lungs. And we know that coronavirus can be very detrimental to the lungs. So with that in mind, what we are talking about for our child and what I have recommended for other people in my circle is that, there's no such thing as zero risk, right? And so just like throughout the last 4 months, 4+ months, we have all had to make very intentional decisions about, whether we're going to go to the grocery store or whether we're going to do Instacart. If we go to the grocery store, are we going to make multiple trips? Are we going to try to batch it? How long are we going to be in the store? All these things. Are we going to, go to our family's house for a gathering? Are we going to attend that wedding that wasn't canceled? So I think when it comes to this situation, as we send our kids off to college, if there are high risk individuals in the home, if we were to follow the CDC guidelines strictly, then they would recommend that if there's any chance that that college student could have been exposed to coronavirus, that when they come home, whether it's for a weekend, whether it's for Thanksgiving, that they self-isolate, or quarantine themselves in an area away from the rest of the family. Now, I know that sounds kind of extreme, but that is the best way that you can not make it zero, but really, really minimize your chances of your college student coming home and potentially exposing and infecting you and the other individuals in your household. Now, if you have a college student who is going to be living by themselves and, they've decided that they are going to basically shelter in place in their apartment, as an example, the same way, many of us have been doing at home, and they have decided that they're going to be really careful, then, you could potentially take that risk. Or maybe the college student decides for the 2 weeks leading up to when they are planning on going home, that they significantly minimize their contact. First of all, anytime they leave their dorm rooms, they should be wearing a mask. But maybe they decide, I'm not going to have any close contact with anybody. Or if they have roommates, and the roommates are doing the right thing, that they don't interact with anyone outside of their bubble, so to speak. And in that case, you can again minimize the risk of exposure. You could also consider having the college student get tested within 2 to 3 days of coming home. Now, the problem with the whole testing, as you all know, is that the test results are taking a ridiculous amount of time to come back. So, it's generally not very useful to get tested a week, 2 weeks ahead of time, because you may be negative in that instant, but by the time your college student comes home a week or two later, they could have been exposed. But the issue that we're having is that the student could get tested, let's say 2 to 3 days in advance of coming home, and they won't even have their result for a week or maybe even more. So in that case, I think the best thing to do is to have them isolate and quarantine and shelter in place as much as possible for the 2 weeks leading up to when they plan on coming home. I do think it's advisable to have them get tested for coronavirus within a few days of coming home. And then until they have those test results, I would recommend that they self-isolate. in the house. If there's a basement or if there's a bedroom, and that again, it gets tricky because somebody needs to kind of like bring them their meals and all of that stuff. But that would be probably the highest level of precaution that one could take. I do have friends that have said that, once my child goes off to school in a week or two, he or she can't come home until Thanksgiving break. And that when they come home, they are going to, make them isolate in their bedroom or in the basement. So I think that's also reasonable. So we all have to just decide what level of risk we are willing to live with. These are very uncertain times, and I hate that we're having to make these decisions. It pains me to know that once I send my daughter off to her off-campus apartment in a couple of weeks, that my husband and I are going to have to make difficult decisions about if she comes home, when she comes home, how she comes home. But these are all practical considerations during a novel coronavirus pandemic. So thank you so much for that question, Marlena. Does anybody else have any questions about sending your kids back to college during a pandemic? Any questions about, health insurance coverage when your kids are away from school? Do you have any concerns about your kids' ability to communicate? I mean, are you all confident that your kids have the skill set to function independently in an emergency room, in an urgent care center, if God forbid, they start to develop symptoms of coronavirus or something else for that matter? It's not like that's the only problem that we are dealing with is coronavirus. The flu season is right around the corner, and there are so many other things, unfortunately, that can happen. There's injuries and things like that. Many of our kids have underlying chronic illnesses. So there's just a lot. There's a lot that even before the pandemic, there's a lot, in my opinion, that parents should be thinking about and should be worried about. And I know that these health concerns often get glossed over in the frenzy of, doing the back to school shopping and all of that stuff. But certainly now that we are in the middle of a pandemic, I am seeing a shift in the parent Facebook groups, and there's more attention and concern to some of these health related topics. So I think, this is a better time than any. Now that we have a captive audience, I know that my daughter has asked a lot of really good questions, and she's concerned really about, her own safety when she goes back to school and she's around, roommates, and are they going to be doing the right thing? So there's just a lot of layers to this, and there's a lot of information that we all need to know. So again, I'm here to answer your questions. For anybody that's just tuning in, I'm Dr. Rochester. I am a board certified pediatrician. I also am the mom of a college junior, and I'm the CEO of Your GPS Doc, and my company is committed to educating and empowering individuals so that they can basically navigate the healthcare system effectively. I'm the author of the book you see behind me. Hopefully that's not backwards on your screen. Healthcare Navigation 101, a guide for college-bound students and parents. It is the only book of its kind. It is a very easy to read, quick read meant for your students, but also for the parents. And basically it walks through a lot of different things that they need to know so that they can begin managing their own health and their health care independently. So I encourage you all to go to Amazon and check it out. There's lots of useful information in there. I recommend the ebook version for the kids. You do not need a Kindle device anymore. You can upload it on your iPhone, your Android, your tablet, your laptop. But the ebook version of Healthcare Navigation 101 has clickable links. So for example, in the mental health section, there's a link that they can click on to go directly to, signs and symptoms of anxiety. So I like the ebook version for the kids because first of all, I don't know about your kids. I'll just talk about my daughter. She's not all that big on physical books. I mean, I can tell over and over again with the semester, she keeps telling my husband and I to get her the electronic version. Whereas I'm old fashioned, like I like paper, and I'm the kind of person that I used to highlight and underline and circle and do all that stuff. But I guess that's old school. I guess they don't do that anymore, or at least my daughter doesn't. So anyway, the electronic version is just, they can read it right on their smartphone. They can pull it up at convenience. They're probably not going to be wanting to walk around, with the book in their backpack or whatever. So this allows them to just, easily click on it on their phones, on their tablets, and then they can click on the links throughout to get additional information. In that book, there is a guide. There's a healthcare navigator summary. Now, this is really, really important. So I want you to listen up for a second. We need to understand that we have been the voice for our kids in the exam room, in the emergency room, in the hospital for some of them, for all of their lives. And so whether they're smart or not, whether they are, just, talkative, any of those things, we have not prepared them for doing this on their own. Okay, very important. And one of the things that I have noticed with my clients and with friends and family is that our kids often aren't familiar with their own medical history, things that may have happened to them back when they were 3 or 4 or 5, and they often are not familiar with their family history. And that is important because the things that run in the family, some of those conditions can present during the late teens and early 20s. And so if our kids are not familiar with their family history, then they're not going to be able to share that information when they are going to the student health clinic, when they're going to the urgent care center, the ER. And so this healthcare navigator summary that is part of the book, Healthcare Navigation 101, it's a fully downloadable document. It's something that your kid, again, can complete and save electronically. And it basically walks you through, it has their name, their date of birth, the names and the contact information for their physicians, the medications that they take, the allergies that they take, their health conditions, any surgeries that they've had. I've just basically made it easy for you all to be able to document this information so that your kids can easily access it if, God forbid, they need to seek medical care. Let's see. Doc Sachet says, "Oh, hey, I like paper, but I also like clickable links. You could buy both." Exactly. So what I say is I tell the parents to buy the paperback version for themselves because this is information that we as college parents need to know. And then I tell them to buy the ebook version for their kids. And you could certainly buy the paperback version for your kids as well. But again, I just know that most kids like to be able to access things electronically. So that's just one of the many resources that is available in the book. Okay, so again, just you can go to Amazon.com and check that out. Do you all have any other questions? I really want to be here to answer your questions, not to give you a lecture about college health. So don't be shy. Go ahead and type in any questions or concerns that you have as you are, preparing to send your kids back to school, or maybe your kids are going to be doing online learning, remote learning. Maybe they're going to be staying home with you for yet another semester, and maybe you have concerns about that as well. Whether they are away at school or home with us, coronavirus unfortunately doesn't look like it's going anywhere anytime soon. And if they're home with you, this is a wonderful opportunity to go ahead and get this information so that you can begin sewing into your kids. And now you have like extra time to prepare them for hopefully a time when they will be able to go onto that college campus in the spring. So I just encourage you all to take advantage of this time and to not to understand that there's things that we can do. I think during a pandemic, there's a natural tendency for us to feel like we're hopeless and helpless, but there are some things that we can do to empower our college students, our kids, so that they can be safe as they prepare to go back to school. So let me know if you have any questions at all about that. One of the other things in the book is we talk about health insurance. Hopefully you all have already checked to make sure that your health insurance policy provides appropriate coverage for your students. So we talk all about that in the book. The other thing I want to share with you all, for those who missed the webinar, is that I have created something that is really special, and I am super, super excited about it. And that is a new exclusive online parent community called the Nurturing Navigators. Now, you may say, like, what is that? Why do I need to be part of an exclusive online parent community? I'm already in the Facebook group for my daughter's school. I got you. I understand that. You all, I'm embarrassed to tell you, but I think I'm in something like 72 or 73 Facebook groups, and I'm not actively engaged in most of them. There are probably about 7 or 8 that I am engaged in that I check on a regular basis. So I know that the last thing many of you need is another Facebook group. This is way beyond a Facebook group. This is an actual parent community that basically is going to be led by me, a pediatrician. So you will have regular access to a board certified pediatrician, to a healthcare expert. And what I am creating is a space where we can come and talk about these types of issues. If you go to your parent Facebook group for your kid's school or university, these types of posts either are non-existent or they are hidden amongst all of the many complaints, amongst all of the questions that get asked over and over and over and over again. You guys don't need me to tell you how the college and university parent Facebook groups work. And so what happens is that if you have a question about, healthcare or the best urgent care center in that town, those things get buried amongst everything else. And there's this frantic search trying to find that post that the parent posted last week about the ophthalmologist in town. So in this community, we are specifically focusing on healthcare, navigating healthcare, keeping our kids safe and healthy during the coronavirus pandemic and beyond. I have my eyes and ears out for everything that's coming hot off the presses related to coronavirus, related to college health. There's so many other things that we need to talk about regarding mental health and just things that we can do to prepare our college students for being independent adults. And so that is going to be the focus of this college parent group. And we're college parents, right? So we're going to be there to support one another, to be a source of information for one another. So I'm going to put the link in the comment section, but I encourage you all to check it out. Today is the last day for the introductory price. It's $14.97 a month. There's no obligation for you to stay 6 months, 9 months. You join, you decide after a couple of months it's no longer for you, then you just cancel. It's not a big deal. But I guarantee you, you will not want to cancel because it is going to be, or it is phenomenal. So we do have a private parent Facebook group. That's just part of it. I'm building a whole learning platform where we're posting articles. We're going to have monthly live Q&A sessions. We're already scheduling our one for this month. So what you're getting now is just a taste of what's going to be happening every single month within this exclusive online parent community. You're going to have access to, all of your GPS doc services at a discounted price. And it's really going to be amazing. There's nothing like this that exists. So I am looking forward to building this community with you all. Kimmy Ray says, hi, Dr. Nicole. What are the things parents should be asking proactively as they prepare to take their children to college regarding COVID? For instance, should they be asking about dining hall services and how that will be handled? Thank you, Kimmy, for that question. Yes. You all, before you allow your students on this college campus, whether they are freshmen or whether they are seniors, you need to understand very clearly what the college has in place. What is their reopening plan? And that includes, are they going to have, roommates in the dorm? Like I told you all at the beginning of this broadcast, one of the colleges put up this little cloth barrier that was no more than, 5 or 6 feet high. That's not cutting it. Like coronavirus doesn't just stop and it's not like it's not going to go above or beyond or around. So that was a very poor solution to, trying to enforce physical distancing in a dorm room. So yeah, you want to know, how are they handling the dorms? How are they handling the common areas? You want to know how they're handling dining. So at my daughter's college, for example, they're only doing single occupancy. So, my daughter lived in a triple her freshman year. They are converting all of the dorms to singles, one person. So you can imagine that had a significant impact on their capacity. But the way they're able to do that is that you're even only allowed to come and live on campus housing if you have an in-person class. So my daughter's school they're not really calling it a hybrid anymore, but there's very few classes that they've determined really need to be in person. And only if you take one of those classes can you be on campus, in campus housing. In terms of dining, they're doing a bunch of grab and go options. So my understanding is that the dining halls are going to be open, but they're basically going to be like brown bagging it. They're not going to have sit down service. And so these are the questions that you need to ask as you make a decision, if you haven't already, about whether or not it's safe to send your child back to school. I guess the one thing I really want to make sure that you all know is that not every school is doing the same thing. Don't assume that because your child's school is reopening and because your child's school is allowing the kids to physically be on campus, that they are doing the right thing. Now, I'm not implying that they are intentionally doing the wrong thing. But what I am saying for sure, and what I have seen already, is that many of them either don't have the funds, they don't have the infrastructure, they did not receive the appropriate guidance in order to be able to reopen safely. So you need to ask those questions. And these are some of the conversations that we're having inside of our private online community, the Nurturing Navigators. I did put that link in the comments, but that's what I mean. Like, these are the kind of questions and these are the kinds of discussions that we're going to have on an ongoing basis. And so again, I encourage you all to look into it. I would love for you to join me. Today is the last day for the introductory price. After today, it's going to go up. It's still going to be incredibly reasonable at $24.99 a month. I pay $54.99, I think, for my Hulu, $15.99 for my Netflix, and we have Amazon Prime and a whole lot of other streaming services. I'm sure you all do too. So, I mean, there really is no price, in my opinion, that you can put on the knowledge and the community and being having access to information that you know has already been vetted by a healthcare professional. So I would love for you all to join us. Are there any additional questions? Let's see. Kimmy says, do you think colleges will eventually shut down like they did in March? The short answer is yes. I hate to say it, but I think that this push that some of the schools have to reopen, I mean, I respect it that they are trying to give our college students, some sense of normalcy. And I also appreciate the fact that the numbers are different. Maybe if your kid's school is in an area where, either it's flat or the cases are going down, where they're not seeing a lot of deaths, where they have, contact tracing in place and testing, and the test results are available in a reasonable amount of time, then maybe, yeah, maybe it's safe to have your child be back on campus. But inevitably, what I think is going to happen is that once these kids get back on these campuses, even with all of the precautions that the schools are instituting, I mean, it's just a matter of time, you guys. Like, this virus loves people. This virus is extremely contagious. And as much as we love our college students, we already know that they're kind of built to be, we'll just say, adventurous. Teens and young adults, adolescents and young adults are natural risk takers. Okay, now this is the pediatrician, Dr. Nicole, talking to you. This is a normal phase of development for late adolescence, early adulthood. So I think that there is a good chance that you couple that normal behavior with the fact that many of our teens and young adults believe that they are invincible, which is also a normal part of development. You pair that up with the fact that many of them believe, and for the most part, this is true, that even if they get coronavirus, they're not going to have a really serious illness. And let me just take a quick pause. And for those of you who may not know, we have had teens, young adults, and even young kids with no underlying health problems die. So I just want to make sure you know that. I'm not on here to scare you. I'm on here to educate and empower. But I've just read a story of a 7-year-old with no underlying past medical problems who died of coronavirus. I think earlier this week, there's been a 9-year-old, there's been 18-year-olds. So while it is not as likely, certainly we know that the majority of deaths are still occurring in individuals over the age of 65. That is still true. But did you all know that the most rapid rise, like the majority of new cases in cities across the country right now, is among kids, our college age kids, around their age. So it's that 20 to 35-year-old age group. So, the college students are part of this age group that are seeing this increase. And that's because of, all the things that we just talked about. The fact that they feel like they're invincible, the fact that they tend to be risk takers, the fact that many of them aren't that worried or afraid of catching coronavirus because they feel like, oh, I'll just have a bad cold and then I'll get over it. So because of all of those things, I do think that for the schools that are allowing them back on campus, that I don't even think it's going to take a month, to be completely honest with you all. I don't even think it's going to take a full month before they are either kicking them back off or at least significantly reevaluating whether or not that was a good idea. LaShawn says, thank you for sharing your expertise. College students think they are invincible. Yes, they do. They do. And I get it. I mean, think back, you all, to when you were in your, late teens, when you were 20, 21. we thought we were invincible too, right? We all can think of some things that we did. We don't have to share them here, but we can all think of some things that we did as college students that may have been a little bit reckless, or we may not have been using our best judgment. We know that their frontal lobes, which is the part of the brain that deals with decision making, they are still developing even at 21, 22 years old. So we're going to give them a little pass on that. But that's why it's so important, and that's why I have been spending my time and effort reaching out to the parents. Now, I know that, we can sometimes come across as nags, but what I have discovered, and I have a 25 and a 20-year-old, what I have discovered is that even when I didn't think that my kids were listening to me, they were listening to me. And so many times they have repeated back to me some of the lessons and some of the things that my husband and I have taught them, some of the values that we have instilled in them over the years. So you may not think this is true, but you have a captive audience right now. Even if your kids are not expressing it, they are worried. I can tell you that the kids, yes, they feel that they're invincible, but there is a part of them that is worried about going back to school, about being around, other people, about getting sick. They're worried about bringing it back home to their parents, to their grandparents, to their other relatives. My daughter is already asking about Thanksgiving. Like, Mom, do you even think we're going to be able to have, a real Thanksgiving dinner? So they're thinking about these things. And so while it pains my heart that we're dealing with a pandemic, I also know that this is a perfect opportunity for us to pour into our kids and for us to begin having these conversations that will help them not only navigate their health and their health care now, but in the years to come. I mean, can you imagine if you have been taught when you were in high school or when you were in college about, all the details about like health insurance and how to communicate with doctors and how to, manage minor illnesses versus major illnesses, and when you should go to the student health center versus when you should go to the ER. Like, nobody teaches us this stuff. No one teaches our kids that stuff. That's the kind of information that we will be talking about in our exclusive online parent community. That's the kind of information that you can get in the book. And then we're going to be delving way deeper than that in the Nurturing Navigators. So again, the link is in the comments. I'm going to drop it in here again for those of you who want to join us. I would love for you to join our group. Let me know if you have any other questions. I am going to hop off of here in just a couple of minutes, but I don't want to do that without answering your questions. So if you have any other questions about college health, COVID or not, about sending our kids back to college, about, the precautions that should be in place, if you have questions about what your kids should be, bringing back with them, in the book, there is a list where you can make your own first aid kit. A lot of this information is available on my website as well. So you can go to yourgpsdoc.com. And again, we're going to be talking about all of this on a regular basis in the Nurturing Navigators. So I'm trying to create as many opportunities as possible to make sure that this information is distributed to college parents. So again, for those of you who are watching, go ahead and tag some parents in the group. Share this video. This video is shareable. So go ahead and share the video with the friends in your circle who are also sending kids off to college. I know it's Friday night. I know not everybody is going to catch this video right now, but it is very important to me that college parents across the country have access to timely and accurate information. Unfortunately, there's a lot of misinformation circulating around. And going back to the parent Facebook groups for a moment, parents mean well, but a lot of times the questions are answered by people who don't have a medical background. And so you have to really be careful when you're taking advice from individuals who may be speaking just based on their own personal experience and not based on, facts and knowledge and medical background. So that's what makes the Nurturing Navigators so special, is that, I'm just the basically the guide guiding you all through, but I'm going to be, taking cues from you all. Like, this community is for you. It's not for me, it's for you. So, the members are going to decide what we talk about. The members are going to decide what resources are made available, and I'm really just there to serve. So again, you can click on the link that I put in the comments. You can learn more about the Nurturing Navigators. Today is the last day to get in at the introductory rate. Let me know if there's any other questions. Okay, LaShawn says, what vaccine should they be taking before college starts? Meningitis, what shots are required? Can you discuss that? Yes. So LaShawn, in general, all college campuses now require the meningitis vaccine. Now, let me just preface this by saying you definitely want to make sure that you have reached out to your child's individual college or university. But generally, as a rule, because of the way meningitis is spread and because of how contagious it is and because of how dangerous it is, all colleges and universities will require that meningitis vaccine prior to your child matriculating. Now, many of your children have probably already gotten the vaccine because it's something that we usually give now prior to college age. So, you can look at your child's vaccine record, you can contact your child's pediatrician for more information, but they absolutely should have that meningitis vaccine. Flu season is coming up, and I know that, that's not a popular topic. I know that many people don't get the flu shot. Many people don't have their children get the flu shot. It is true that the flu shot has variable efficacy. So a lot of times people will be like, I got the flu shot and I still got the flu. There's a myth that people think you can actually get the flu from the flu shot. That is not true. I don't have a lot of time to go into the details of that, but you can get symptoms. You can get maybe a little achy, but you cannot actually catch the flu from a flu vaccine because that is a killed virus. Okay, so that's all I'm going to say about that. But because we are in the middle of a coronavirus pandemic, and because the flu and the coronavirus, those symptoms are so intimately similar, I would recommend, I'm sure your child's pediatrician would recommend, that they get flu shots, particularly this season, so that they are at least protected against one of the many viruses that's going to be circulating during the fall, winter, and early spring. So those are the main ones, LaShawn. Of course, in general, all of their regular vaccines should be caught up. So the best person to consult about that would be your child's pediatrician so that they can make sure. And generally, these colleges and universities, in their enrollment forms, there's going to be a health form that your child will need to fill out, and they're going to ask for usually a copy of those vaccine records, and they will let you know typically in the form what vaccines they need to have had. That's a great question, LaShawn. All right, you all, I am about to wrap up. If there are any last minute burning questions, please go ahead and type those in. I know that there is a little bit of a delay, so I'm going to hang on here for a couple of minutes, but I want to make sure that I have addressed your questions related to COVID-19 and college and your college students' health. Thank you to all of you who tuned in live. Thanks to all of you who tagged someone. I appreciate that. Let's get this message out there. Thank you to those of you who are going to watch this later on the replay. I really appreciate you. You're welcome, LaShawn. All right, you all. So I'm going to wrap up. Again, my name is Dr. Nicole Rochester. I'm a board-certified pediatrician and independent health advocate, the mom of a college junior, the author of Healthcare Navigation 101, and I've created a brand new exclusive online parent community called the Nurturing Navigators. We would love to have you join us in this group. We are going to have a blast. I'm excited about all the things that we are planning and talking about. We're going to have our first live Q&A session next week. It will not be on my Facebook page. You will only have access to these live Q&As if you're a member of the group. So I encourage you to go to the link in the comments section and check that out. You're welcome, Carla. All right, you guys, have an amazing weekend. Stay safe, stay well, and I'll see you next time. Take care.